Dr. Erin Dial, physical therapist and certified strength and conditioning specialist. This is our third video in our first series of videos. It was 3 questions total. The first question was, why go to physical therapy? The second question we covered was what to expect during your visits. And now we're moving into the third question that everyone wants to know: how long will recovery take? So answering the question, how long will it take to recover, is very difficult to answer because it can vary so much based on what tissue was injured or what surgery you were recovering for, what your age is, what your activity level is. But I will give you some basic guidelines of the recovery process, and everyone moves through this recovery process. What can vary is the time that it takes to move. There are 5 different phases of rehab. The first phase is managing your pain and swelling, and this is where the price principle comes into play. You want to protect the area, you want to rest the area, you want to ice the area, compress it, and elevate. And all this makes up the price principle, where you're just trying, your main goal is to just reduce pain and swelling and to get that tissue feeling better. Phase 2 is where we want to restore range of motion and normal arthrokinematics. Arthrokinematics is how the joint moves. So once we've gotten the pain and inflammation down, we're going to focus on the range of motion. Range of motion can be broken up into 3 different types. You have active range of motion, which is where you move your own joint. You have passive range of motion, where someone else, like the therapist, moves your joint. And then there's something called active assisted range of motion, where you might use like a rope and pulley system or like a wand or a bar in order to move that joint using your good arm to help move the bad arm. So we work on all 3 types of range of motions to put the joint in the best position to improve your arthrokinematics. And this helps us move into phase 3, the strengthening phase. Phase 3, strength training, is a very important phase to help you get back to doing your daily routine. So we are going to focus on both your global muscles and the smaller muscles that move the specific joint, the localized muscle. The global muscles are the muscles that you tend to see in the mirror, like we talked about earlier, your mirror muscles. So that's going to be your pecs, your deltoids, your quadriceps. So those are important muscles that we do need to train to help support the joint, but we also have to work on the localized muscles. For instance, there's a muscle that runs from vertebrae to vertebrae in your back called the multifidi. I'm sure no one that works out at the gym has heard of that, but it's a very important muscle to help give you good postural control and help prevent herniated discs. Strength training involves so many different aspects, and that's where the schooling that the therapist and the physical therapy assistant, that all really comes into play, because we're deciding how many reps you're doing, how many sets you're doing, what joint angle are you doing in order to make it more tolerable. We're keeping in mind any of your previous injuries, if you have a neurological involvement. And so there's a lot to do in the strength phase in order to get you back to doing your daily routine. Phase 4 is the neuromuscular control and proprioception. So neuromuscular control is how your nervous system controls your muscles, and that involves the input from your brain to your spinal cord, down the motor neurons, and to the muscles. So we want to get that pathway more and more efficient so that, again, when you're doing your daily routine, everything becomes just second nature. Proprioception is your ability for your joints to tell where they are in space. So when my elbow is bent at 90 degrees, there's proprioceptive receptors inside the joint that is telling my body and my brain where it is. Phase 5 is your functional and sport/work specific level, and this is what we all want to obtain. So when we start physical therapy, we want to know, when am I getting back to my daily routine? Daily routine can actually become a form of therapy. So when you are putting on your socks and shoes in the morning and you're having to bend over, if that's something that you couldn't initially do and now you're doing it, Continue to do it and it becomes part of therapy. So I know that was a broad answer to the question of how long will it take me to recover. When you come in and meet with myself for that initial evaluation and we figure out what's going on and what impairments you have, I will be able to give you a more specific answer to that question and be able to give you a time frame so that you can make decisions about when I can go back to work, or when can I play with my grandkids again, or when can I play those sports that I love. So that concludes our first video series on the common questions that patients ask. The first question was, why should I go to therapy? The second question was, what should I expect during my visits? And the third question was, how long will recovery take? All of these videos can be found on our YouTube page, website, and Facebook page.